The theme for this year's assembly is appropriate and also timely. Health for peace and peace for health. Indeed, this phenomenon is not a new one, as is evidenced by one of the principles of the WHO Constitution, recognizing, and I quote, "The health of all people is fundamental to the attainment of peace and security and is dependent on the fullest cooperation of individuals as well as states," end quote. The challenge, therefore, is for us as leaders to determine to what extent health is being used as a tool or a bridge for peace, and conversely, how we can recalibrate our policies to recognize the centrality of peace as a key prerequisite for health. I wish to commend the work of WHO in this area under the Global Health for Peace initiative as part of its contribution to the maintenance or restoration of international peace and security. The unfinished work of the SDGs, compounded by the multiple crises such as conflicts, food insecurity, escalating energy prices, and the consequence of climate change, demand a WHO that is fit for purpose. Enhanced technical and financial capacity of the WHO, particularly at country level, is key if the WHO is to successfully leapfrog member states closer to their national health-related goals aimed at a highly dynamic and challenging environment. We especially welcome the launch of key initiatives such as the WHO Academy, the WHO CTAP, and the related mRNA manufacturing hub and spokes, which will contribute to strengthening or establishing biomanufacturing capacity within developing countries for greater resilience. The COVID-19 pandemic necessitated the rapid development of diagnostics, therapeutics, vaccines, and other global public health goods. The pandemic, however, also exposed the over-dependence of developing countries to external markets, thereby hampering efforts to ramp up production of the necessary health products as well as technologies. To support the sustainability of new manufacturing initiatives, all stakeholders must come together to address the financing, coordinated technology transfer, including affirmative action, as well as market access for locally manufactured products. Going forward, we would urge Gavi, the Global Fund, PEPFAR, and other major vaccine and essential medicines purchasing organizations to lead the way in prioritizing procurement of these locally manufactured health products from the countries they serve most. We call on WHO to promote the success of these manufacturing plants through supporting regulatory systems, strengthening the expeditious pre-qualification of these locally produced products, ensuring market access and procurement for the finished products from these spokes. Madam President, Kenya is pleased to have been selected as one of the MRA spokes, which will complement the WHO Emergency and Logistics Hub in Nairobi. Through the Africa CDC, Eastern Collaborating Center in Nairobi, we are committed to building the necessary capacity in Africa for health emergency prevention, preparedness, and response. And we stand ready also to provide and surge capacity in other countries when called upon to do so. In this year, commemorating the healthcare workforce, I would be remiss not to mention the dedication and commitment of all our health and other essential workers throughout this crisis. Throughout this pandemic, WHO has been instrumental in galvanizing the actions of governments, scientists, development partners, and the public in taking actions that were needed to contain the transmission of COVID-19. Here again, I commend the Director General, Dr. Tedros, for his exemplary leadership and commitment during one of the most challenging periods ever experienced by WHO. This would not have been possible without the consistent commitment and exceptional expertise, and indeed the sacrifice demonstrated by the entire Secretariat. In 2020, there was a rise in the global burden of malaria, with an estimated 627,000 deaths and 241 million new cases of the disease. No single tool that is available today will resolve the problem of malaria. I therefore call for greater investments in innovations for malaria, TB, HIV, and other neglected tropical diseases. Innovations that will bring about new disease control approaches, diagnostics, medicines, and other tools to speed the pace of progress against these priority diseases. As one of the malaria endemic countries, Kenya, together with Mali and Zambia, are currently piloting targeted sugar-based products intended to prevent outdoor malaria transmission. Kenya was also instrumental in the development of the malaria vaccine and is one of the 3 countries to pilot its use alongside Ghana and Zambia. Indeed, in my inaugural speech of 2017, we did announce my administration's Big 4 agenda for economic development. And among these was a promise to attain universal health coverage by the year 2022. In addition to food security, affordable housing, and manufacturing, but to attain UHC, my administration, with the invaluable support of the WHO, has undertaken major policy and legal, as well as administrative reforms within our health sector.
There can be no health without peace. But equally, there can be no peace without health. The authors of the WHO Constitution knew this when they wrote that the health of all people is fundamental to the attainment of peace and security and is dependent on the fullest cooperation of individuals and states. Health can contribute to peace by delivering services equitably to all people in a society, especially disadvantaged groups. This can help address the triggers of conflict, such as unequal access to health care, which can often lead to feelings of exclusion and resentment. Equitable health services strengthen community trust, which in turn contributes to strengthening health systems and peace building. For example, in Tunisia, in the aftermath of the Arab Spring, and with WHO support, a social dialogue for health was established as a platform for Tunisians to express their needs and ideas on health. In Sri Lanka, WHO has supported community-based psychosocial intervention called Manohari, aimed at violence reduction. In Colombia, WHO PAHO supported the reintegration of former combatants with health expertise in the health system through medical training. The resolution on health and peace that you will consider this week, if adopted, will further support the Secretariat's efforts to deliver health programs in conflict-affected areas, programs that also help to build peace. Health is one of the few areas in which nations can work together across ideological divides to find common solutions to common problems and build bridges.